My name is Missy Love. My connection to Momcology began through one of my very first Onco-Mom friends. Finding Momcology opened a door to a community of people who truly understood this life without explanation. For me, Momcology became more than just a support network. It became a place where I felt seen, heard, and connected to other mothers navigating the same overwhelming realities of caregiving and childhood cancer. It is so important to have a space where I can be honest about both the love and the struggle that comes with this journey. Momcology helped remind me that even in the hardest seasons, none of us are meant to carry it alone. This topic is important to me because for the past 18 years, my life has been caregiving. It started when my son, Trey, developed cancer at just 1 year old. And from that moment on, our lives changed forever. Since then, it's been a constant battle with countless medical issues, hospital stays, emergencies, fear, exhaustion, and uncertainty. People often see the caregiver as a strong one, but they don't see the weight we carry behind closed doors. There were times I drowned in anger, anxiety, depression, and addiction because the emotional pain became too heavy to hold alone. When you spend years living in survival mode, constantly terrified of losing your child, it changes you. But I've also learned that coping doesn't mean being perfect or fearless. Sometimes coping is simply getting out of bed, showing up again, and loving through your child through the hardest moments imaginable. Caregivers need compassion too, because this journey affects every part of who we are. I would like to introduce you to our guest. Dr. Natalie Nageeb is a pediatric psychologist in the Cancer Center at the Children's Hospital of Philadelphia. Dr. Colleen Cadigan is an oncology psychologist at the Children's Hospital of Philadelphia. She is also an assistant professor in the Perelman School of Medicine at the University of Pennsylvania. Drs. Nageeb and Cadigan, we are so happy to have you with us. We are grateful for your willingness to share your expertise in this area. Welcome.
Thank you for all being here today. Just wanted to start by acknowledging something important. No one signs up to learn how to cope with a child's cancer diagnosis. And the fact that you're here likely means that you're navigating something incredibly difficult and often incredibly overwhelming. As caregivers of children with cancer, you're asked to take on so many roles at once, all in a context of uncertainty that you didn't choose and can't fully control. It's natural in this experience to feel like you need to find answers, to stay strong all the time, or to somehow get ahead of what might happen next. And that's sort of where that control piece comes in. Many caregivers describe living in a constant state of what ifs, trying to prepare for every possible outcome while also managing the day-to-day demands of treatment and care. So just want to be clear about what today is and what it isn't. This is not a space where we're going to try to eliminate the fear or the uncertainty or, of course, the distress. Those responses honestly make sense and are natural given what you're experiencing. So instead, what we'll focus on is practical, everyday ways to help you move through this experience with a little more steadiness and a little more support. We'll talk about how stress shows up in your mind and body, and we'll go over specific tools you can use in real moments, whether you're sitting in a hospital room, waiting for results, or trying to get through an ordinary day that just doesn't feel ordinary at all. The core idea we'll return to throughout this webinar is this: while you cannot control everything that is happening, there are small, meaningful ways you can influence how you respond to it. And those small shifts can make a real difference over time. As we go through this, I encourage you to take what feels useful and please leave what doesn't. There is no single right way to cope. Uncertainty and unpredictability is one of the few things you can expect in the pediatric cancer experience. Whether it's things more immediate, like when you're expected in clinic or sick visits to the hospital, or not being able to make the simplest of plans, like even meeting somebody for coffee or responding to an invitation due to the unknowns of what will be required or what could pop up because of treatment. And then there is the unexpected or ambiguous elements that are even less measurable, like the stress of trying to protect your child's immunity, the what ifs of getting sick, or how will my child manage treatment? Will I be able to help them through it? And then even bigger layers of uncertainty. Will my child survive this? Will they have late effects that might impact their future? Will I ever be able to breathe again after this loss? Will I ever feel okay again after this traumatic experience? The cancer journey and beyond encompasses endless potential for the unknown. So cue the stress. Then we add getting ready for it immediately. Diagnosis hits and all at once, and then for a prolonged period, you're in this stress. Ready, set, go. Of course, there's going to be a struggle. It's expected with everything that you're faced with, and coping will be a challenge. No one is designed for this. Emotions will run high. They could get erratic. They could get confusing. It's all unfortunately normal, while taking on this degree of stress and worry with very little tangible control. And this isn't just your one role. Now add that, even aside from your massive parenting role, you're now an advocate, a decision maker, a source of comfort, and often the person holding everything together for your family. Again, no one is designed for this. There are no real life superpowers. There is no right way to cope, just getting through it. As miserable as the stress response is, it is our natural security system for emergencies, for us to know when to fight, when to run, or even shut down or go numb in the face of a threat. So for better or for worse, it is built in. Many caregivers worry that they're not coping well. So self-compassion when these natural stress responses kick in is absolutely critical. Beating oneself up for what the mind is naturally built to do only makes things worse. Common signs: irritability, poor sleep, racing thoughts, numbness, feelings of overwhelm, physical symptoms such as headaches, stomach upset, weakness, frequent illness because of the stress's impact on immunity are all expected. These are biological responses, not failures to cope. Just like all these other emotions, guilt is often a natural response as well. But this one can be particularly painful. Not surprisingly, however, it is also adaptive. It keeps us strongly keyed in by monitoring ourselves to ensure we are taking the best possible care of our children. Not doing enough, divided attention between maybe other siblings or other responsibilities that you need to take care of, difficult decisions, feelings of helplessness, these can all trigger a feeling of guilt. This statement on the right side really is a great way to reframe guilt. It's a natural reflection of how deeply you care. It's love in a heavy form. Please remember that it is a reflection of your heart. It's only realistic to aim for doing enough and not doing everything. Okay, so great. We've covered that this is all very natural, right? But now what? There's lots of ways we as people try to manage stress, and Dr. Cadigan will discuss some great ones later on. But the one we're here to discuss today is control, and how sometimes it can be a problematic coping strategy. We know in reality, there is very little that we actually control in our lives and in the world. But if we swam in that realization every day, no one would get out of bed. So psychologically, we try to control what we can and preserve that experience of the world making sense and having order, basically to feel safe again. Unfortunately, when there is a very life-threatening event, or what many would call a crisis, that natural response to control can go into overdrive to get back to that feeling of stability and predictability. But unfortunately, it's the wrong tool for the job. It is absolutely natural to apply this desire to control to be able to regain the safety for ourselves and even more so for children, but that doesn't mean it's effective. So now that we know that, we can remind ourselves and be more aware when we're trying to use that tool that probably won't work very well. We can make a conscious decision to switch to more helpful coping strategies that are better suited for the circumstance. Sometimes this control response can be helpful with some everyday types of things, which you've probably experienced, but not when being faced with something that truly cannot be controlled, is that intense, and needs to be managed over a longer period of time. When trying to control in that type of a circumstance, we will often find ourselves more exhausted, scared, and defeated. But of course, this is way easier said than done. And this distinction is the furthest from simple. But the empowering outcome over time is well worth the effort. If we can distinguish between uncontrollable and controllable situations. Uncontrollable medical outcomes, treatment responses, timing and uncertainty, other people's emotions and reactions. What is controllable? Your responses, your daily routines, how you care for yourself, and how you offer support and communicate. This piece about reacting, responding, that is the piece that we have more control over. It is not easy by any means, but it's important to remember that we can try and influence and try to support other people's reactions, but we ultimately can't control them. The only reactions we can control are our own. It's important to be able to distinguish between responsibility and influence. We really need to be able to shift the goal when it comes to coping. As we stated earlier, as you'll see in that line in the bottom, this is really an important concept. We're not trying to reduce the fear, but increase our capacity to tolerate it. This distinction is really important because fear is absolutely natural. It is a natural response. To be able to eliminate it or drastically reduce it in a situation where it is a natural response is an unrealistic expectation. Many caregivers I've heard have said things like, I'm not coping well because I'm terrified. That's not a good measure of whether or not one is coping effectively. It's more of whether or not one is able to tolerate that unavoidable fear and be able to still function day to day and do what needs to be done. So this is a real core psychological pivot that can really make or break one's mindset. Instead of I need certainty, I can handle uncertainty. Instead of I must control everything, I can influence my response. And please, again, this is much easier said than done. It is not a one-time mindset change. It requires a great deal of practice, but that awareness of where our mind automatically goes to is key, because once you notice you're doing it, then you have the opportunity to shift your gaze.
Okay, so now we are shifting to what we're calling the coping toolkit. This isn't about fixing everything or making the situation feel easy, because what you're going through is very real and very hard. Instead, this is about giving you a set of practical, flexible tools to help get through the day-to-day, moment to moment. Different strategies will work for different people, and what works one day might not work the next, and that's okay. The goal here is not perfection. It's to offer options, to find small ways to support yourself while you're supporting your child. You can think of it as a toolkit you can come back to and draw on as needed. So first, we want to introduce grounding skills. These are simple tools you can use when emotions start to feel really intense, like anxiety, feeling overwhelmed, or distressed. This is not a permanent fix. The goal here is much more immediate. It's to calm down the nervous system in the moment. As Natalie discussed, that fight, flight, or freeze or alarm mode that our bodies go into when experiencing intense stress, grounding helps signal your body that you're safe right now, and the intensity can dial down even just a little. That's a small shift that can make it easier to think clearly, make decisions, and respond in ways that feel more intentional. So these tools are things you can reach for that are portable, can be used anywhere in a hospital room, in a clinic setting, but they can help you get through the moment with a bit more steadiness, which is the goal. One example I like to use with parents is a mental grounding strategy where you can use the alphabet to think of things in the room that begin with the letter A, where are all the things in the room that begin with the letter B, C, and so on. Another idea is looking around your environment and trying to find all the things in the room that are blue, green, red. Again, the idea is to just signal that you're safe and dial back the intensity of the acute stress. For our next coping strategy, we'll move into cognitive coping, starting with the cognitive distortions or stress thinking traps that our brains can quickly fall into, as listed here. But to bring them to life, I'll give some examples as they relate to caregiving. An example of catastrophizing or assuming the worst would be Johnny didn't make counts for chemo this week. If he misses a round of chemo, he will relapse. An example of black and white thinking: I was late to give Johnny his medication. I'm a terrible parent. We are often shoulding ourselves. I should have noticed he was feeling off sooner. I should be able to manage this better. Or overgeneralization. Johnny needed to be poked twice for port access when we had Karen as our nurse. Karen will never be able to access him. Now, how do we deal with these stress thinking traps? You want to think about the 3 C's. Our intention here is not to invalidate the fears or worries you're having for your child. Those worst case scenarios come from real risks that you're facing. The idea is we're not looking to force optimism or say that there's nothing bad that will ever happen. Instead, we want to emphasize flexibility in thinking. To do that, we want you to notice the thought, which can be a challenge all in and of itself. Check the thought. So what is the evidence? Is there another possibility here? And again, this idea of, is the thought true and helpful? So if the answer is that it's true, because a lot of your fears are very much based in reality, as I've said, is it a helpful thought to be having right now? And that's often where you can, show yourself that it's time to make that shift. How can we change the thought? Generate a different alternative to it. Using language is really helpful here. So maybe instead of always, language matters and creates a little breathing room. So for example, with the port access example I gave with the stress thinking traps, that Johnny needed to be poked twice for port access when Karen was our nurse, so Karen will never be able to access him again. Want to shift to that was a difficult access and it was stressful, but that doesn't necessarily mean that Karen can't do it again in the future. Next, we'll talk about micro control, or the idea that small wins matter. What you are facing is overwhelming, complex, and deeply significant, and we're not trying to minimize the gravity of the situation. What we are saying is that in the middle of something so big, small actions can have powerful psychological impact for both you and your child. Small wins matter because they create a sense of control in a situation that's often feeling unpredictable. They help structure days when everything is feeling uncertain. And they remind you that you're making progress. You're thinking about the end of treatment, and that's so far off. So these day-to-day small wins can show you that progress is happening in real time. We want you to recognize what you're already doing, getting out of bed, checking items off the grocery list, getting your kids where they need to be with school sports activities on top of clinic. These are things that we want to recognize and celebrate when everything else feels really hard. Another important piece is emotion regulation. I want to start by saying that every emotion you're having right now is valid. Fear, anger, sadness, hope, grief, all of these emotions are normal to experience, sometimes even within the same day. The goal here is not to get rid of these feelings, but to help you move through them a little more gently. One step is just noticing and naming what's coming up. Even something as simple as saying, this is anxiety, can help create a little bit of space between you and the feeling. Then we want to work towards accepting it as a normal response. Instead of thinking, I shouldn't feel this way, we shift to, of course I feel this way, this is really hard. We also want to avoid the extremes of either pushing emotions down or feeling completely overwhelmed by them. There's a middle ground that we hope to strike where you can acknowledge the feeling without it taking over. Allowing the emotion to move through. Emotions naturally rise and fall if we give them space, whether through talking, crying, writing, or just pausing for a moment. Again, the goal is not perfection. Even small moments of noticing and allowing your emotions can make a real difference. We want to encourage self-compassion. Caregivers are often harsher on themselves than they would be on others. That doesn't mean lowering our standards for what we expect from ourselves, but softening them and reducing that self-attack. A really great strategy for doing this is thinking about what you would say to a loved one or another caregiver in a similar situation and helping apply that to how you're talking with yourself. Another area that is really important and equally as hard is asking for help. First, I want to normalize that this is difficult. Many of us are used to being the ones taking care of others, and it can feel very uncomfortable and vulnerable to ask for support for ourselves. At the same time, in a situation like this, help is not optional. It is absolutely necessary to do what you're doing. It is simply too much for one person to carry alone. Asking for help is not a sign of weakness. It's actually a way of protecting yourself so you can keep showing up for your child. It doesn't have to be something big. Small things like asking someone to drop off a meal, sending a text, someone sitting with you during an appointment. Those all count and they can add up in a meaningful way. There are also benefits beyond just getting through the day-to-day. Accepting help can help deepen your relationships. It gives the people you care about a sense of purpose and a way to show up. Over time, it can feel easier for both to give and receive support in the future. A helpful way to think about this is to think about the different circles in your life. You might start by asking yourself, who can be helpful and in what ways? Family and close friends might be helpful for more personal and ongoing support. Neighbors or community members, like from school, church, or sports groups, can help with practical tasks. Your hospital team can provide emotional and informational support. And there are also regional and national organizations that can help provide both concrete and therapeutic resources. It can be helpful to think about who is best suited for practical help or emotional support, because not everyone can do both in the same way. Again, this isn't about doing it perfectly. It's just about beginning to let some of that support in whatever way feels manageable. Another important area is boundaries and communication. First, with your medical team, this is a space where your voice really matters. It's okay to ask questions, even more than once. It's okay to ask for clarification if something doesn't make sense. There's a lot of information often delivered quickly, and you deserve to understand what's happening with your child's care. You're an important part of the team, and asking questions is not being difficult. It's being engaged and informed. Then when it comes to others in your life, this is where boundaries are really important. You might find that your energy is limited right now. That is completely understandable and normal. It's okay to set limits, whether that's saying no to things, not responding to a text right away, or deciding how much to share and with whom. Protecting your energy is not selfish, it's necessary. It helps you focus on what matters most and sustains you over time. So overall, this is communication in both directions, speaking up when you need clarity and setting limits when you need space. This is something that you can do in small ways and no need to do it perfectly. It can be helpful to create a daily coping plan with some of the skills from the toolkit. Something is simple, sustainable, something that you can do even on the hardest days, just a little structure to support you. Each day, you might aim for a few things from the skills we discussed today. The focus is consistency, not perfection, and even doing one or two things on the hard days count. Over time, the small intentional moments can create a sense of steadiness in the middle of a really difficult experience. So you might choose for your daily coping plan to do one grounding practice, one thought check, one small controllable action, and one meaningful moment of connection.
So now that we've talked about some more effective coping strategies, we want to just pivot a little bit to the idea of burnout and sustainability. Again, the cancer journey is an extended one. It is not just, something that you have to push through over the course of a month. So really being able to have your finger on the pulse of how you're doing, to be able to recalibrate, take a minute when you need to, employ those strategies when needed is really important. When you get to a point that you're experiencing extended and prolonged periods of emotional exhaustion, detachment, like you're really struggling to connect with others and, really just not functioning the way that you typically do, even when under stress, it might be time to pause and ask yourself what's needed. You need to be able to rest when possible, take small breaks, and as cliche as that mask that drops down during an emergency on a flight, it is really true. You need to be able to take care of yourself if you're going to be able to continue supporting everyone else around you. So these bullet points are really key. Be honest with yourself with what's left in your tank, and don't fall for that horrible tendency that we have to convince ourselves we can continue to run on fumes because we're so used to it. There is a tipping point. There is a point where you are no longer functioning. We promise as psychologists that is an actual thing, and you don't want to find out after you've already hit it. So please pay attention to all of these pieces. And if it really is affecting your functioning and your relationships and your way of existing in your everyday life, it may be a good idea to start looking into professional support. So in summary, we included some key takeaways on this slide. It is absolutely natural to have that instinctual coping strategy of control. There are many that we pull from. Some are adaptive, some aren't. This one can be adaptive, but only with smaller everyday stressors. When we try to control something that is largely out of our control, it ends up becoming more of a liability. Full control is impossible. You can influence your experience. You cannot fully control that either. That is something that takes practice, and good enough rather than full control, and eliminating those negative emotions is really what we want to aim for. Coping is a skill that can be practiced. Small tools that, that Dr. Cadigan just reviewed make a significant difference over time. And self-compassion is key as you're navigating an incredibly difficult situation. You are not designed for this. So support is essential. You're not meant to do this alone. So as we said, trying to bring down the nervous system and trying to dial back the stress, focusing on smaller concrete steps is really, really key. What is one small thing I can control today is a great place to start.
Thank you, Doctors Nageeb and Cadigan, for taking the time to share your expertise with us today. We had a lot of questions come in, but we noticed several common themes amongst them. So we kind of came up with a few, if that works for you guys. I'll start with my first question. How can families recognize and more effectively cope with medical PTSD after treatment experiences?
Medical PTSD is unfortunately incredibly common in the populations we treat, both with the patients as well as with their caregivers. And it's a really great question because I think it can be very difficult to differentiate between what is just sort of chronic stress and then what escalates to the point where now we're saying this is sort of a clinical diagnosis of PTSD and trauma. I would say, in terms of trying to identify whether or not somebody has PTSD as the reason for why they will or will not seek professional support, that might already be the answer. If you're in a point where you're already asking yourself that, I'm thinking it might be time to go and really be able to process through some of that incredibly challenging experience. But for additional information, some symptoms of post-traumatic stress disorder can be, when the mind gets triggered or reminded of the things that were the fearful threat, there can often be sort of an imaginary reliving of that experience, or where it could, feel as though you were right back in that moment, even though there's no present threat at the time. And it could show up as, reliving when you're sleeping in the form of nightmares, or just really feeling that activated sense of terror when the threat is no longer, really present. But again, with all of that said, I will say if an individual is in a position where they're questioning whether or not they have trauma from the experience, and they're trying to differentiate that from, is it just normal to have this much stress? I think it's natural to already assume that there's enough distress there that it warrants seeking additional support.
How can parents and caregivers navigate emotional reactions such as anger, anxiety, or mood changes in ways that model healthy coping and minimize additional family distress?
Oh, this is such a good one and comes up a lot in our work. The goal is not to hide our emotions from our kids. It's to show them that they can be managed. The kids don't need us to be emotionless. They just need us to be regulated enough. So instead of suppressing the feeling, it's helpful to name it and model coping. So I'm feeling really sad right now. It's been a hard day, but I'm okay, and I'm going to go take some breaths. You might even invite them to do that with you. to co-regulate together can be really helpful. If there are times when emotions escalate, which they will, as we've sort of gone through in this presentation, these emotions will get intense and things will escalate. It's important to remember that we can always repair. We can always come back to our kids and say, I'm sorry that I yelled. I was feeling really frustrated. I'm working on it. Here are some things that I try when I'm feeling frustrated. Offer a hug, offer that physical comfort, and repair. It shows our kids that when they're feeling similarly and they escalate, there is a way to seek that connection again and to recover. It's okay to have big feelings and there's a way to handle them. And we're working on this as a family is really important messaging.
Thank you. Next question is, what are some of the most common adjustment challenges families face after treatment, and what type of supports are most helpful?
Yeah, I have to say, I think this is one of the most common misconceptions that families have, that after treatment concludes, life is going to feel largely fine again. Everyone's, moods and temperament, routine, the whole nine will just, over the course of maybe a couple of weeks will just kind of fall into place. Unfortunately, I think what we often see is because there is so much chaos and stress and responsibilities and the millions of things that caregivers need to be hyper vigilant over, and so do our parents during the period of treatment, that it doesn't really always leave too much space to really process the emotional end of things. And once treatment ends, that's when things sort of pause. And when some of that kind of that emotional fallout, if you will, can start to hit. And families can often feel somewhat anxious and even at times abandoned because they're not getting the same degree of caretaking from their hospital team as much as they used to. But it doesn't mean they're suffering any less, because it is another period of time that requires a great deal of adjustment. And because, they know that, well, the doctors, the nurses, the teams are still treating other patients who are under active treatment, it sort of leaves everybody else in a little bit of a weird limbo space after treatment ends. So I feel as though self-advocacy in that situation is really, really important, and being able to be open and honest about that with your team, saying, this is what my experience has been since treatment has ended, and we do need some additional support. And if the hospital team is not able to directly give it to you, then at least they can provide some resources in the community to be able to get it on their own.
Thank you. All right, my final question is, how can families understand and cope with the repeated or evolving experience of grief that may arise across developmental stages, particularly when late effects become part of survivorship?
That's also a great question. We know that grief is not a linear process. And also in this particular context, grief is not a one-time experience. It can reemerge with the developmental trajectory, especially when late effects show up, when a child reaches a milestone where it's highlighting differences or challenges in the moment. The idea is that we can't prevent those moments from happening, but we can prepare ourselves for them. A few ways to do that would be to anticipate those key transitions, be aware that stages like starting school, merging into adolescence, anniversaries of cancer diagnosis or anniversaries of completing treatment. These are times that often bring up the new waves of emotion, and just expecting it can make it feel less jarring, or can sort of prevent that period of time where you're feeling heightened emotions and questioning why you're feeling them. Another important thing to sort of prepare is to create space and normalize that ongoing conversation. So letting yourself and your child know that these are feelings that we're going to revisit over time, and that it makes sense that the feelings will come up again depending on what we're experiencing, and sort of reframing it from being a setback in your managing grief and really just a normal part of the process. Another thing is that we're hoping that by addressing how to cope while we're sort of in the thick of it on treatment, that those skills that we're practicing with and building will then be things that we can call upon when, you know, we're facing a transition and the grief response is coming up again. What was helpful to me in the difficult time that I can access now? And sort of with that, what supports do I have to access in these moments? So whether that's, you know, a mental health counselor, my hospital team, a trusted person in my life, maybe even another cancer mom, so that you're not figuring out in the moment who to turn to. You sort of have that running list accessible in your mind. So again, like less about preventing the grief because we know it's normal, and more creating a plan for it so that you can more easily, you and yourself, you and your child can move through it more easily.
Thank you so very much. Thank you, Dr. Nageeb and Cadigan. You have no idea how much it meant today for you guys to be speakers. Thank you for everything that you do as well. And thank you, viewers, for checking in and being supportive and listening to all of us. Thanks so much.